Hello Matthew, how's it going?
Good, thanks.
That's good. Hey, let's take a look at your medical history form, eh?
Well, I hope this is one test that I have passed.
Well, it looks fairly unsurprising, except for the question about the radiation therapy which you have ticked. Would you be able to tell me a bit more about that?
Yeah, when I was 25 years old, I had a pain at the upper back of my throat. So when my GP sent me to an ENT surgeon, he found out that I had a squamous cell carcinoma.
Carcinoma? Yeah.
Yeah, so that was nuke with radiation.
Okay. Well, that's quite a story, but it's good to hear that it was a good outcome. Did you have to have any dental treatment as part of your radiation protocol?
All my bottom molars were taken off during the radiation, and during the treatment, we went for 6 weeks. I saw a dentist who reviewed my teeth and saliva, so he recommended me to use fluoride gel, which I ended up using for 15 minutes every night.
And how have you been coping dentally since the radiation treatment was completed?
Not good at all. I have been suffering from a really bad dry mouth seeing the radiation, and my teeth been wearing at a faster rate. My last dentist has stuck up some white material to slow down the wear, and now it sort of feel alright. Other than that, I'm doing okay. Cleaning my teeth, and I'm on a good diet.
That's great, Matthew, as it's very important in someone who's had radiation, as the risk for decay remains really high. Are there any other dental problems that you are aware of?
Yes, I would really like something to help me chew, because since they took my molar teeth out, I find it hard. It's a shame they were healthy, but they still took them off.
Well, it's all about preventing some of the nasty downstream problems that can happen when molar teeth sit in bone that has been exposed to a lot of radiation. And then they break down and they need to be removed. The bone that sits around the extraction socket doesn't heal up very well because the radiation damages the blood vessels. It's a process that's known as osteoradionecrosis.
Oh yeah, I've heard that before, but it sounds pretty scary.
That's one reason why it remains so important to look after all our remaining teeth. Now, tell me about your chewing issues.
I have to stick my lower jaw forward to make my teeth tight together, and I can't really chew like I used to when I had my molar teeth.
Right, I understand. That's a normal set of responses to missing all your lower teeth.
So can you fill those places now with crown or dentures at all?
Crowns would need to sit on implants which would then be placed into your jawbone, which can be a bit of a challenge given all the radiation that you've had. Tricky, but not impossible. Those sort of things need a lot of careful planning. So let's start with a full checkup, and then I'll take some x-rays to assess the rest of your mouth.
That sounds okay to me. After all I've been through, I'm no stranger to people looking into my mouth.
We'll need to check your saliva and also tune up how you look after your teeth at home, given that that's important as well.
I haven't had a saliva test before, but spitting in the tube wouldn't be too hard.
Well, so first things first, your lips look rather dry. Are they normally like that?
Feel all the time.
Okay, and there seems to be an almost healed up cold sore on your bottom lip in the middle.
Yes, that's from last week, almost gone now.
Okay, now I'll just get you to open your mouth there for me so I can have a look at the soft tissues. Now just looking around, I can see that your tongue is coated and the lining of your mouth appears to be quite thin and dry in some areas.
It's been like that for the last 5 years. Hasn't really changed much for the last couple of years.
Okay, so if you have to have anything dry like biscuits or crackers, can you have them without water?
No, I have to have them with water. Anything dry.
Okay. Your teeth look fine. Just a bit of staining from the stainless fluoride gel. But there doesn't seem to be much plaque around And there doesn't seem to be any calculus where you would normally find them, which tells me that the quality of your saliva is probably not that great.
Yeah, sometimes the saliva is like blue and white. Other times it's just missing.
Okay, well, I'm just going to have a look at your gums just to see if there's any pocketing. Just open for us. Thank you. Hello, Matthew. Here's your report card, so to speak.
So what did you find?
Well, your amalgam fillings look okay. But with your resin buildups, there's definitely some wear going on. And there is some decay around your fillings that will need to be repaired or replaced.
So there's some housekeeping there?
Yes, well, because of the tooth wear that's going on, we need to try and protect and conserve whatever remaining teeth we have, just to prevent any further loss. But as far as your gums are concerned, there's not much pocketing at all, so that's really good. Just a little bit of recession, so that's looking good on that side of things.
What about the saliva's result in the x-ray?
Yes, well, no surprises there. There is, it definitely shows some damage to the salivary gland due to all the radiation and some acidic saliva, which is definitely driving the tooth wear. It takes a few days for the bacterial test to come back, so we're going to have to talk about that the next time we meet.
Okay.
Hi Matthew, how are you today?
Good, thanks.
That's good. The bacterial tests and the saliva samples that we took have come back.
Any good news at all?
Well, as you know, your salivary glands have been damaged from the radiation. Therefore, it doesn't produce very good quality saliva. Therefore, your mouth is very dry and you are experiencing quite a bit of tooth wear. And the saliva that was tested was very acidic indeed.
So how does that change the bugs that grow in my mouth?
The bugs which survive in acid do very well and they overgrow. And that's what the culture tests show. The two main groups of bacteria that we often test for when assessing for decay risk were quite high, which are mutant streptococci and lactobacilli.
Is there any way you can change that?
Yes, we can most certainly change your home care program to include certain things which will help reduce these decay-associated bacteria from growing and attaching. Well, I've got a printout for you here of a sheet with the options, so we can custom design that to suit you.
What about my chewing function?
Well, the x-rays show that the bone of the lower jaw has filled in where your lower molars were removed. So your teeth are looking fine, so that's positive. We will, however, need to do a special x-ray called a cone beam x-ray. And that's just so that I can assess the quality of the bone and the dimensions of your lower jaw. And I'll need to take some impressions for some study models so I can assess your bite in greater detail and do some planning.
So you think I might be good candidates for implants?
Well, we need to take things slowly with the treatment planning. And yes, if all goes well, I would like you to see an oral surgeon who does a lot of implant cases on patients who have had radiation therapy, just because there will need to be some modifications made to the procedures to take into account the low healing potential of your lower jaw.
Even after 5 years I had the radiation?
Yes, definitely. We need to be very careful.